Karibu, welcome to Maliheh Free Clinic. We're so grateful you're here to help us reverse the cycle of poverty and suffering created by poor health. As a patient tech, one of your roles is to collect vitals, and that includes blood pressure.
Accurate blood pressure technique is super important because it can help prevent serious issues like stroke, heart attack, permanent eye damage, and it also ensures the correct diagnosis. In this video, we're going to cover the correct ways to get an accurate blood pressure, the symptoms you need to look out for, and what to do when you find an abnormal value.
According to the American Heart Association, there are certain steps to ensure accurate blood pressure measurements. We will be focusing on 4 key components in obtaining an accurate blood pressure. All you need to remember is P, P, C, C. We will cover each aspect one at a time. The first P stands for patient position. The patient should be sitting up in a chair, offering back support with their feet flat on the floor. The second P stands for pause. It's important for the patient to have a natural rest period to obtain an accurate measurement. It is recommended you complete the reason for visit, take their temperature, and measure oxygen saturation. Performing this portion of the intake prior to obtaining the blood pressure allows for a natural rest period for the patient while managing time wisely. If your patient has a condition requiring a blood glucose check, wait until after the blood pressure is measured to perform this task. The first C stands for cuff size. Patients come in all shapes and sizes. There is no one-size-fits-all blood pressure cuff. If a cuff looks to be the wrong size, it probably is. It may be helpful to think like Goldilocks when selecting the proper cuff size. Not too big, not too small, but just right. The last C stands for cuff placement. The devices we use here at Maliheh are designed to evaluate blood pressure via the brachial artery. When placing a cuff on a patient, the artery marker should be placed over the brachial artery located on the medial portion of the upper arm. The cuff must be placed directly on the patient's skin. If the patient is wearing long sleeves, ask them to roll one up. If the patient's sleeve is too tight on their upper arm, it could act as a tourniquet, which would alter the blood pressure measurement. Ask the patient if they would remove the single arm out from under the clothing. If you or the patient are not comfortable with this process, notify the charge nurse and they will instruct you on how to proceed. There are some critical values you need to be aware of at Maliheh. A critical value is a systolic pressure of 150 or greater and or a diastolic pressure of 90 or greater. If a patient's blood pressure is elevated to a critical value, it could represent a serious issue. Before taking action, we need to make sure the abnormal value we received is accurate. Did you follow the principles of P, P, C, C? Then switch the blood pressure cuff to the patient's other arm and have the device repeat the measurement again. If the reading is still abnormal or vary greatly from the first reading, you would confirm the value with a manual blood pressure. The equipment for manual reading may be found in the bottom drawer of the exam room. Write all 3 values down or document them in the notes section of the patient's intake in the EMR. After confirming the abnormal values, check with the patient for signs and symptoms that would indicate a possible hypertensive emergency. Are they lightheaded, dizzy, experiencing a headache, chest pain, or vision disturbances? If the answer to any of those is yes, stop what you are doing and notify the patient's provider or the charge nurse as soon as possible. If the patient answers no to all the signs and symptoms of concern, you may finish the intake. After exiting the exam room, immediately notify the patient's provider of critical values even if there are no other symptoms. If the provider cannot be located or is with another patient, notify the charge nurse. A patient may have a serial blood pressure performed upon provider request. The device will automatically obtain 3 blood pressure readings at timed intervals and provide you with the average value. To program the device, press the clock button on the screen. You will see the screen display averaging and program 1. At this point, inform the patient the blood pressure cuff will inflate and deflate automatically 3 times. Instruct them to relax and remain still while the cuff is inflating. Let them know you'll step out of the room so they can completely relax while the serial blood pressure is obtained. Upon completion, the average blood pressure will be displayed. Document this in the EMR. To set the machine back to single reading mode, press the Home button. An accurate blood pressure measurement is important because it can help prevent conditions such as strokes, heart attacks, permanent eye damage, kidney disease, and other serious issues. When assessing blood pressure, remember PPCC, which stands for patient position, pause, cuff size, and cuff placement. Critical values at Maliheh are a systolic pressure of 150 or greater and/or a diastolic pressure of 90 or greater. If a critical value is obtained, remember to confirm the value by repeating the measurement and checking for signs and symptoms such as lightheadedness, dizziness, headache, chest pain, or vision disturbances. If a patient has a confirmed abnormal value and is experiencing one or more symptoms, notify the provider or charge nurse as soon as possible.